Hello, everyone, and welcome to our show. Welcome.
Thank you very much for having me.
Homeopath, author, just an expert, natural medicine. Michelle, you've been on the show many times.
Thank you.
Wellspring.
Thank you for having
Spa.
us. You're so kind to us.
My pleasure. Tell us, what can you tell us about, I guess, keeping ourselves healthy? I know it's such a big job I'm giving you, but just, help us out a little bit.
It is actually the best way to be healthy is that using a lots of vegetables and fruits and nuts, actually, we could say, because fruits and vegetables has lots of vitamins and minerals, and on the other hand, so you need some proteins. So this protein you can get actually naturally from the nuts. Of course, you can use different kind of protein, animal proteins also, but
We don't have to.
you don't have to, really. And of course, these days, all the animal products is full of the estrogen and also growth hormone and the other things that is causing cancer and causing a lots of different kind of the problems. So it's better to go to that way, to vegetarian and using really vegetarian.
So you think, I'm just going a little bit off topic, but if someone, eats, how much can one person eat that will be enough? Because, not everybody can eat this, consume the same amount of food.
Yeah.
Vegetables and fruit and nuts. Is that enough, or do you need to supplement it?
Oh, these days, actually, I would say that we need supplements. Right. We look at the pyramid of the nutrition, actually, because we call it the pyramid, because the top part, the apex, is very small. So we need a little bit essential oil on the top. Then the second part is proteins. And we can use the animal proteins. They can use different kind of proteins. And so we need proteins, or we need meat, 1 gram per kilogram of our body weight. So it means that a person that's 70 kilo, so 70 gram meat is enough for it. But these days you see that we are having 10-ounce steaks. That's about 300 grams. Too much, really. And then when we are coming down to the pyramids, actually that would be vegetable mostly. And the biggest part when we are coming down, that's carbohydrates. And the bottom part, that's the biggest part, is exercise.
Yeah.
That we ignore all of them, all of us.
I'm not even going to talk about that. I'm the most guilty of that. I say every day I'm going to do it. Every day I'm
we don't
going
have
to
time,
do it.
really. Yeah.
No time, no time.
No, we just, we can find the time. We just choose not to find the time.
Of course.
And I know it's one
that's
of the
only
most
excuse, of course.
It
But of course, another excuse that is so cold here,
I'm guilty for that. I know. I can watch them exercise on TV, and I'm like, wow, this is great. But I won't get up to do it.
Looking at that's a nice.
So I understand.
Yeah, and so based on, and as I said, that we need supplement because most of the vegetables and fruits that we are taking these days actually free of lots of different kind of minerals that we had, for example, 50 years back. Why? Because using a lots of pesticides, herbicides. Usually you get the fruits actually picking up from the tree unripe. It's not ripe yet. So the fruit actually should be ripe under the sun that gets the energy of the sun and get lots of different kind of the minerals that we need. And also the soil is depleted these days. So we don't have that much soil, topsoil that we, for example, had 50 years back.
So what are we to do?
That's really it's so
That's
difficult.
Definitely difficult.
No wonder when people are getting sick. Like, what are you supposed to do?
So really, and these days they say that because of the lack of selenium in the soil, we have lots of different kind of cancers actually. So this is another thing. So we need supplements. We don't get enough vitamins and minerals that we need from fruits and vegetables.
So what kind of vitamins or mineral that is, not individually, like, is there something that everybody should take?
I think so.
Okay.
I think so because you see that even if we take lots of vegetables and fruits and this, it's not enough because it doesn't have that. For example, selenium as an example, we don't get enough selenium from the fruits and vegetables and from the soil. So then we have to take the supplement. So vitamin A to Z, actually, then we need it to get that.
So people
lack
can
of.
just take the vitamins themselves, or
Oh
they
yeah,
should
of
come to
course, of course.
specialists?
Something else that usually the people make mistake is that they are hearing that okay, we need minerals, we need supplements. Then they go to the store,
And there's
then
hundreds of them.
hundreds of
I
them,
know that I've
and
got.
then so
And I'm like, which one is good? Which one should I take?
yes,
And,
and asking the
don't know.
salesman, and then so they want to sell. Actually, they give him something. So
It's- yeah.
nobody going to the nutritionist to ask them what they need, because really they should be assessed. The person is different. Two persons completely are different from each other, and different kind of supplement they need. So that's why that I suggest that anybody that wants to get supplement, they go to the nutritionist and ask them what they want, because nutritionists actually assess them, and they have a different kind of question asking them, and then so find how much they need vitamin and minerals. For example, a smoker maybe needs about 10 grams of vitamin C
A
a day.
smoker should quit smoking.
Quit the smoking. That's the
That's
first
right.
thing.
First it is quit smoking.
Because smoking gets rid of a lot of the
Yeah.
vitamins.
Yeah.
And I can say that because I was an ex-smoker, so I can
Oh,
tell.
ex. Okay.
Wow,
I can
congratulations.
say-
How many years?
Oh, many years ago. But I know how hard it is to quit, but I quit.
It's
so I
one
can
of the
say
hardest,
it,
they say.
It's very hard, But I mean, I quit about maybe, God, I don't know, 12, 13 years ago. So
Oh,
a
wow,
long
that's
time.
good. That's
wow,
good.
yeah. But, so I can understand. But, okay, I understand you. So
That's right, yeah.
different people have different needs.
For sure. And also different minerals and even environment, actually. So the people that living in, for example, maybe Africa, that they are not taking at all any pops, so it should completely different than the one that, for example, living in States and taking coffee every day, pops every day. So these pops and, for
French
example,
fries
because
every
French
day.
fries and this kind of thing. So they're taking, actually, if even they take the supplement, they take a mineral, they take iron. So this phosphoric acid that is in the pops, so taking out the iron and calcium, magnesium from their body. So they need more. That's why we have lots of osteoporosis so in actually affluent country, we can say. And so depend on the person, depend on the environment. So we need different kind of the vitamins and minerals. The one that, for example, living in China needs more vitamin C than the one that living, for example, in California with a nice weather, and so
Or in Florida, we're
Florida,
all,
nice.
orange juice.
Or we need more
Understand.
vitamin D that more than the one that living in the tropic areas for getting a lot of sun. So that's
see
why.
no sun
So
Where's your offices?
my office in Richmond Hill. So
Both
I have
offices are in
a
Richmond
both we have both offices in Richmond Hill, and so I have a clinic over there and also surgery room.
Surgical,
And,
Cosmetic Surgical Center.
Then I have also different kind of classes with training center. I have a colleges actually there that they train for the homeopath, for the natural medicine, for
Aesthetics.
statics, for massage therapy, for Chinese medicine, acupuncture. So all the alternative medicine actually we have under one roof there.
So Michelle, tell me, how are you associated with this lovely gentleman?
Well, he's my husband. And as well, he's actually running the Bell Springs Medical Center, and just about 3 kilometers north is on Younger Street is my clinic, which is strictly cosmetic, non-surgical cosmetics.
So tell me, what kind of patients would come and see a homeopath?
The patient that I have mostly are those that they have been to the doctors for a long time. So they didn't get any results, so they come to me. So maybe some of them, 20 years, for example, 10 years, they have been to doctors or to specialists, everyone, then so they didn't get any answers, so they came to me. Because we are looking at the disease actually different ways. And we want to find the cause of the problem, not only giving the,
How to
suppressing
treat
the symptoms.
How to treat the symptoms.
That's why that this way, I'm using, of course, different tools like iridology, like, for example, diagnosis from even the nails, to look at the nails, to look at the face even, to look at the ear and tongue. These are all giving us the best result, actually. So giving us the causes of the problem. We can find the causes of the problem. That's why that after 2-3 sessions, the patient actually find themselves that much more better than they have been, for example, for 20 years that I've been to the different kind of doctors.
So I'm just going to ask you something. So, okay, so let's say you find, the reason, but you can't, but some reasons cannot be cured. Or maybe you're going to
No,
tell
I
me
tell you that
know?
based on the homeopath and Chinese medicine, we can cure everything.
Really?
If I cannot cure, it means that I'm not the knowledge. I don't have enough knowledge of that homeopath or Chinese medicine. But based on the law of medicine, I mean that the law of the homeopath and Chinese medicine, anything should be cured because anything should be because of when we find a problem. So that was easy then. And I tell you, about maybe 90% of the problem we can cure. But that 10%, that's because of the lack of knowledge that still we cannot.
Sometimes they need to consult with other homeopaths or other professionals. It's like specialists, sometimes they put together their knowledge to discuss a certain type of operation or, conventional medicine.
Because what we're saying is, there's so much more diseases today than
Of
they
course.
were okay, let's put it this way. Are there really more diseases today, or is it just that we know more about them?
No, we know more about
Maybe they
that.
just exist,
Of
but
course,
we didn't know
of
about
course,
them.
No, also we have more diseases today because of based on our environment, because of the pollution of the air and all of those things.
But we also
because
have
it's
different
completely-
diseases
yeah.
50 years ago that are no longer in existing now.
For sure,
With other, like with the penicillin, with the antibiotic. So there's, certain things that,
For
we
instance,
managed
there's an
to
epidemic
eliminate.
of autism.
Okay, tell me about
Before, 1 in 150 child may.
150. Okay,
Now it's 1 in every 68,
wow.
and I think
That's
it's
like double.
underestimated.
Yeah, it's growing. Yeah.
Why do you think that is?
Well, of course, it might be because of the first vaccination. Second might be because of the environmental and pollution. And so usually the pregnant women mostly taking the same thing as we do, because all polluted, all because full of, for example, pesticides, herbicides that we are using, that's chemical.
Yeah.
These days, we are bombarded by the different kind of chemicals that we take. And
But it's
so,
everywhere we turn. Like, how can you eliminate it? How can you avoid it if everywhere we go?
really, some of them we cannot, but
It's sad, but like, what can we do? How can
Yeah.
we? Okay, so we take supplements. So we cut down on on the meat. We buy organic. What else can we do?
But still people
nothing
get sick.
actually, because even if you want to do that, still we can't, because you see that every year the government, for example in Canada, the government changing the seeds that wheat and for example wheat and rye. So this year when you get the bread, you buy the bread. This is not the same bread that you got last year, because completely genetically engineered, completely genetically modified. So still we don't know what's happened to the new generation actually.
Right.
In 10 years, in 20 years, we
They're
don't know
gonna tell
what
us that
gene actually,
yeah.
because there was no research on that.
Right.
There is no research, we don't have any research. So that's why everything changing. And we will get actually the new diseases day by day.
Also,
And-
there was at one point they were encouraging people to get H1N1, and I heard and I saw on TV that they said people who had H1N1 vaccine, they're prone to get a lot more
lot more disease
influenza than
than before,
others.
We do if you don't. But I do believe in health. I do believe that vitamin and minerals, taken daily are good for you, and you should take them. I do believe in eating healthy, and I do believe in doing exercise, even though I don't do it myself. I should be doing it, but I know that it's an important part of our health. I hear you.
Necessary.
I know.
It is. Yeah.
I neglected it for one year because of the cold.
Yeah, we find different excuses. So what else can you tell us?
I think the best way is that to have a healthy life is that doing all of those, using actually natural food as soon as possible. Because anyway, maybe we cannot get everything's organic, but at least we can, for example, this is in our hand that don't go to the fast food, for example, getting everyday fast foods or fried foods, and at least the oil that we are using, so better to have the oil that is good, for example, for us, not having the saturated oil. And so we have to stay away from all of those pollution, chemicals, and this kind of thing. Actually, somehow we can do that. And using, of course, the supplement that we need. The supplements that, especially calcium, magnesium, if we are in low iron, so we're using iron, and all of those things that our body needs. Go to a naturopath, go to a nutritionist, and find actually what you need, what kind of things.
I'm listening to you, and I just wanted to know, what do you feel about the B12 complex?
Uh,
Because I've been hearing a lot of people are saying that, they need to take, B12 supplement or,
Yeah, because
or injection
B12
of
actually, yeah, B12 because you need a transit factor in your stomach to absorb B12 from the foods. Those people that they are vegetarian, mostly they are lack of vitamin B12. And so that the best way is that getting through the injection, because through the actually digestive system, maybe they cannot actually digest it. So that's the only way that they can get. And of course, some of the vegetarian, if they have a complete intrinsic factor in the stomach, they can absorb it. So they can use also some vegetable, means that, of course, sea vegetables that mostly they have full of vitamin B12, so they can get also the B12 from them. But the best way for them is that you get the injection because absorb very fast in the body. So that's most of the vegetarian, yes.
And
there is
without
lack
the
of,
B12, people
lack
don't get any absorb any iron.
Yeah, I don't know.
Do you see in your field, do you see people that, I guess, don't take vitamins or not? Do you see it on their face? You must see it.
Well, a lot of people who lose hair, especially,
Hair.
because they have somehow a deficiency of iron.
Losing hair.
A lot of women that lose hair, because it's not common for women to become bald.
I heard some things in the news about DNA testing. Is it something that you do in your clinic?
Yes, we do of course, we don't do in our clinic, but we get the test from, that collect the test in our clinic and also sending to US for the result. This is, I think, that's the best thing that you can do for your life, because what's happened that it gives you all those diseases that you will get later on, or that was in your genetic, actually.
Okay.
So if you are carrier for something, they will tell you. So it's very easy, actually, to prevent. And also, together with the test, they come a booklet. That this booklet also giving you the nutrition, what you have
Wow.
to take. And it is
Wow.
so. It is something like actually you insure. Actually, that's a kind of insurance for your life.
Oh, don't say it, because
Because-
the insurance company will tell you everyone to do that.
Really, some of the insurance company doing that actually,
Really?
because they will find out how long then you will be okay, and then so what kind of diseases you
If
will
you
get
have
later
that, you
on.
can actually get a
it's
better
so
insurance.
nice.
So can change your destiny.
Really,
Your
I
heart?
was the first one that I got for myself, and then I find actually if there is anything in my genetic, and so what kind of the gene is, what kind of the diseases that I'm carrier.
Wow.
So if my heart is okay, or if anything is okay, so that's very good actually.
Wow. So can anybody request that DNA
Anybody
testing?
can do that. Of course, it's a little expensive. It's $1,500, but it's really worth it because even, if the government doing that for all the people, you know how much they can save
Prevention.
later on with the hospitals? Because if they know that a person, for example, another 10 years they'll get a heart attack or something,
They can
so they can
prevent
prevent that. Sometimes this heart surgery or this kind of things, $100,000 actually cost for the government. So they can prevent it.
That's
so
so
it's so
interesting.
nice, so interesting.
Wow. The DNA testing, it's really
It's really good, yeah. It's really
change your
something,
destiny.
yeah.
It's
That's
amazing. That
really,
is
yeah.
amazing. Well, listen, you two are I don't know. It's such educationer.
Oh my goodness.
It is. It's a privilege because every
Nice.
time you guys come here, I always learn something new, and you share it with the rest of us. Thank you so much, and please
Thank you.
come again.
Thank
and
you
talk
very
to us
Thank you so much
more.
for having us.
Thank
Thank
you
you
for
very
having
much,
us.
Michelle. Thank you,
Thank you,
and
Gila,
I
always.
appreciate it.
For sure, we come back.
And
Good.
thank you
Yeah, like
for everybody who's watching us.
A pleasure,
Thank
and
you.
I will
It's
have
our
to say
pleasure.
goodbye, and we'll see you next week.